The message that World AIDS Day brings year after year resonates even more during these difficult times. World AIDS Day is meant to unite people in the fight against a deadly disease. It's what we do right now amid the COVID-19 pandemic. Now, with us this morning is Anastacio Marasigan, Executive Director of the group TLF Share. The group's goal is HIV prevention through education, awareness, and preserving human rights. Good morning, Anastacio. Now, your team has a new study specific to HIV/AIDS. Please tell us more.
Well, this study was commissioned by the United Nations AIDS. This study studies the impact of COVID-19 on people living with HIV, especially in terms of social protection. So specifically in terms of accessing social services, employment, psychosocial support.
Can you explain to us so that we can understand better what you and the other members of the team are doing to partner with the Department of Health in the fight against HIV?
Well, when you speak of the partnership, one of the most critical way of addressing HIV and AIDS, especially in times of pandemic, is we really have to work together with the national government, the Department of Health, and at the same time with the local government units. Because when you speak of the pandemic, there were a lot of PLHIV who were displaced, who lost their jobs, who lost income, and at the same time, they've lost their support system. So we really have to work with the Department of Health, with the local government units, so that people living with HIV/AIDS will not be displaced further because of the pandemic.
Right. I mean, obviously, our immediate focus seems to be on dealing with this pandemic, but it obviously complicates the issue of educating people and bringing awareness to the issue, the long continuing issue of HIV/AIDS awareness. What are some of the challenges, Anastasia, given that the Philippines is the fastest growing number of HIV/AIDS cases? Is that still the current state?
Yes, if you're going to look at the current data, the Philippines says every day we have at least 35, 35 new infection. But because of the pandemic, there was a drop. No, but again, remember the pandemic put a stop to a lot of government operation, including testing and screening. So still, despite of this so-called stop in terms of testing and screening, it's still around 21, 21 per person a day. Now, one of the challenges that is currently facing people advocating for the prevention of HIV/AIDS is how do we reach people who are living, who are totally detached from the centers, people who are detached from accessing services that are currently, again, limited in terms of operation. So again, that's one of the major challenges. But at the same time, it is also an opportunity for civil society to innovate, to come out with creative ways in terms of continuously delivering services. We have a lot of initiatives being done by CSOs in terms of reaching, like for example, the use of social media. There's an increase in terms of social media presence with regard to the issue of HIV/AIDS. There's so much online information and campaign with regard to HIV/AIDS, and at the same time connecting it with the issue of the pandemic.
Right. You bring up a great point, actually, Anastasia, that although we may see a dip in the numbers or a dip in the figures, we're also actually going to experience a dip in the services rendered to the community. So you bring up an excellent point there that although numbers will be down, services and assistance will also be down. For people who want to lend a hand and lend a little bit of assistance, what specifically are you looking for, especially those watching who would like to pitch in and help? How can we all sort of lend a hand?
Well, number one, the first thing that we really have to do is share correct information about HIV and AIDS. We really have to share information to people that are actually marginalized, people who are, quote unquote, at risk, as what was mentioned earlier by your report. At the same time, we have to ensure that people living with HIV should not be discriminated, should not be further stigmatized. So remember, people living with HIV are actually immunocompromised, so they're very vulnerable to COVID-19. So again, people living with HIV are now carrying double burden, living with HIV and at the same time the fear of getting infected by COVID-19. So again, people living with HIV should not be stigmatized and discriminated. And at the same time, we really have to continue participating and asking the government to step up in terms of investing more in the existing health services that we have right now.
All right. Well, today marks rather a very important day. Thank you for reminding all of us to keep those dealing with HIV/AIDS top of our thoughts. Thank you so much, Anastacio Marasigan from TLF Share.